Okay, class, we finished the circulatory system, and now we move on to Chapter 13, which is the blood. So we're going to identify terms relating to the composition, formation, and function of blood. We're going to differentiate among the four major blood types, differentiate among the different types of blood groups, identify terms related to blood clotting, build words and recognize combining forms used in blood system terminology. Describe various pathological conditions affecting blood, describe various lab tests and clinical disorder procedures, and apply your knowledge to understanding medical terms in proper contexts. All right, so blood itself, what does it do? It transports foods, gases, and waste to and from the cells of the body. Other transport items are chemical messengers such as hormones, and blood proteins, white blood cells, and platelets. The cells of the blood are erythrocytes, which are red blood cells, leukocytes, which are white blood cells, and platelets. You also have plasma, which is mostly water, waste, nutrients, salts, hormones, lipids, and vitamins. Okay. And cells are 45% blood volume. Erythrocytes, red blood cells, transport nutrients and oxygen. Leukocytes are white blood cells. Thrombocytes are platelets that clot the blood. Now, within the realm of leukocytes, or underneath white blood cells, you have basophils, which contain heparin. They prevent clotting, and histamine, involved in allergic responses. So if you have a high basophil count when you do your CBC, you may have allergies. So that could be, or eosinophils, which are phagocytic cells involved in allergic responses. You might have high eosinophils as well, or you might have a parasitic infection. So high eosinophils could be, you could have a tapeworm or allergies. Again, that's why we never rely on just one test. We want to do multiple tests to kind of confirm the diagnosis. Now, neutrophils are phagocytic cells that accumulate at sites of infection, so high neutrophils would indicate some sort of infection in your body. Monocytes, phagocytic cells that become macrophages and digest bacteria and tissue debris. And lymphocytes control the immune response, make antibodies to antigens. Okay. So if you look at this, under the cells, you have erythrocytes, which are red blood cells, thrombocytes, platelets, and leukocytes. And under leukocytes, you have neutrophils, eosinophils, basophils, monocytes, and lymphocytes. And you also have the plasma portion of blood, which is water, salts, nutrients, hormones, and vitamins. But the proteins are albumin, globulins, fibrinogen, prothrombin, alpha, beta, and gamma, and immunoglobulins are the globulins. All right, so the plasma proteins that you'll see are albumin, globulins, fibrinogen, prothrombin. Okay. Fibrinogen and prothrombin are more the clotting proteins. And albumin, it maintains the proper proportion and concentration of water in the blood. The globulins, not goblins, but globulins, they're another part of blood maintaining the plasma proteins and alpha, beta, and gamma globulins. And then immunoglobulins are antibodies that bind to and sometimes destroy antigens or foreign substances. So a type A antigen and antibody B. Type B is a type B antigen and anti-A. Type AB, A and B. Type O, no A or A, B antigen. So these are the different types of blood types out there. So you're either type O, type AB, type B, type A, and you can be A positive, A negative, B positive, and the RH factor determines if you're positive or negative. There is a very good YouTube video. Let me see if I can give you the link so you can watch that to see the different types of blood types. All right, so just to kind of give you a summary, there are 7 blood types in addition to the universal recipient type, and then we'll talk about which one is the universal recipient and why. They are O positive, O negative, A positive, A negative, B positive, B negative, and AB negative. So therefore AB positive would be the universal recipient. So O blood types are unique in that they have no antigens. O negative blood is considered the universal blood donor because it is compatible with all A, AB, and O positive types. So the universal blood type donor is O negative. If you have blood type A, you have an antigen that is specific and unique to A blood. If you have blood type B, you have a B antigen. The AB blood type means that both of the antigens for A and B blood are present. It's the rarest blood type. A person with AB blood has all of the antigens that are possible. So again, here's 2 links to a YouTube video that are great. You can write those down and look those up. But the universal donor, as far as blood goes, is O negative. That's because O type blood has neither A or B type antigens nor a rhesus factor. So your own blood cells are usually covered in those antibodies against foreign blood or blood that's not of your own kind. And individuals with type AB blood can safely receive blood from a donor with any ABO blood type. All right. So blood clotting, coagulation. So the platelets, there's an injured blood vessel, then platelets will aggregate, and in combination with tissue and protein clotting factors, calcium, vitamin K, thrombin, and thrombin change, and then the fibrinogen will turn into a fibrin clot. The blood contains which of the following to transport oxygen? So the answer for this would be D, red blood cells. Blood contains which clotting cells? Erythrocytes, plasma, thrombocytes, or leukocytes? And the answer to that would be C, thrombocytes. So albumin, antibodies AB, and antigen. Albumin is a protein in the blood, maintains the proper amount of water in the blood. Antibody AB, a specific protein produced by lymphocytes in response to bacteria, viruses, and other antigens. An antigen, so this is very important to understand, a substance that stimulates the production of an antibody. Basophil, bilirubin, coagulation. A basophil is a white blood cell that contains granules that stain blue. Bilirubin is orange-yellow pigment in bile formed by breakdown of hemoglobin when red blood cells are destroyed. Coagulation is blood clotting. Colony stimulating factor, differentiation, and electrophoresis. Colony stimulating factor is a protein that stimulates the growth of white blood cells. Differentiation is the change in structure and function of a cell as it matures, specialization. And electrophoresis is a method of separating serum proteins by electric charge and size. Eosinophil, erythroblasts, and erythrocytes. White blood cell that contains granules that stain red. Erythroblast, an immature red blood cell. Erythrocyte is a red blood cell. Erythropoietin, EPO, fibrin, and fibrinogen. EPO is a hormone secreted by the kidneys that stimulates red blood cell formation. So sometimes athletes will inject themselves with EPO to get advantage. I think if you remember Lance Armstrong, he used to inject himself with EPO. So it produced more red blood cells, therefore you have more oxygen and you fatigue less. Fibrin is a protein that forms the basis of a blood clot. Fibrinogen is plasma protein that's converted to fibrin in the clotting process. Globulin, granulocyte, hematopoietic stem cells. So globulin is a plasma protein. Granulocyte is a white blood cell with numerous dark staining granules. Hematopoietic, a cell in bone marrow that gives rise to all types of blood cells. Hemoglobin, hemolysis, and heparin. So hemoglobin is a blood protein containing iron. Carries oxygen in red blood cells. So hemoglobin, when your hemoglobin count, when you do the CBC is low, especially in women, you can be anemic. So that's a lack of oxygen. And you can get fatigued quickly, cranky, irritable if you're anemic. Hemolysis, breakdown of red blood cells. Heparin is an anticoagulant found in blood and tissue cells. Immune reaction, immunoglobulin, and a leukocyte. Immune reaction would be a response of the immune system to foreign invasion. Immunoglobulin is a protein with antibody activity. Leukocyte is a white blood cell. Lymphocytes, macrophages, megakaryocytes. A lymphocyte is a mononuclear leukocyte that produces antibodies. Macrophage is a monocyte that migrates from the blood to tissue spaces as a phagocyte and engulfs foreign material and debris, destroys worn-out red blood cells. Megakaryocyte is a large platelet precursor cell found in the bone marrow. Monocyte, mononuclear, and myeloblast. A monocyte is a leukocyte with one large nucleus, engulfs foreign material and debris, becomes a macrophage. Mononuclear, pertaining to the cell leukocyte with single round nucleus. A myeloblast, immature bone marrow that gives rise to granulocytes. Neutrophil, plasmas, and plasmapheresis. Neutrophil is a granulytic leukocyte formed in bone marrow. Polymorphonuclear leukocyte. Plasma, liquid portion of blood, contains water, protein, salts, nutrients, lipids, hormones, and vitamins. Plasmapheresis, removal of plasma from withdrawn blood by centrifuge. So if you've heard of PRP injections, they would plasma-rich, oh gosh, what is the PRP? Plasma-rich. No, my bad. PRP is platelet-rich plasma. So basically, it's injection of concentration of the patient's own platelets, and you can inject it like in your tendons, ligaments, joints, and in this way, it should jumpstart the healing process. So I've had some patients with that help. Sometimes it helps, sometimes it doesn't. But it is a little expensive. I think it's $500 a shot. So you can look that up, PRP, if you've had some chronic tendon issues. Platelet, polymorphonuclear prothrombin. Platelet is a small blood fragment important in clotting. Polymorphonuclear, pertaining to a white blood cell with multi-shaped nucleus, such as the neutrophil. Prothrombin is a plasma protein converted thrombin in the clotting process. So you can measure your PTT time to see how fast you will clot. Those that are on blood thinners, they'll measure their PTT time. Reticulocyte, Rh factor in serum. Reticulocyte is an immature erythrocyte, Rh factor antigen on red blood cells of Rh positive individuals, and a serum is plasma minus clotting proteins and cells. So stem cells, thrombin, and thrombocyte. So a stem cell is unspecialized cell that gives rise to mature specialized forms. A thrombin is enzyme that converts fibrinogen to fibrin during coagulation, and thrombocyte are platelets. Okay, so let's look at base. So base. So basophil, white blood cell with dark staining granules that have an affinity to basic dyes. Chromo is color. Okay. Coag is clotting, so anticoagulant would be a substance that works against coagulation, blood clotting. Cyte is cell, so cytology, study of cells. Isano is red, dawn, rosy, so eosinophils are white blood cells with dark staining granules that have an affinity for acidic dyes. Granules turn red in the presence of the dye. Erythro is red, so erythrocytopenia, deficiency of red blood cells. Granules, so granulocyte is a white blood cell with large dark staining granules in its cytoplasm. Hemo is blood, so hemolysis, destruction of blood cells. Hematocrit is another way, separation of blood, percentage of red blood cells in a given volume. So if your hematocrit is low, that can be concerning. Hemoglobin, so hemoglobinopathy is a disease of abnormal hemoglobins, such as sickle cell anemia. Iso is the same. Okay. And kary is nucleus, so megakaryocyte would be a cell with multiple large nuclei, immature platelets. Leuco, white, leukocytopenia, deficiency of white blood cells. Mon, single, monocyte, white blood cell with one large nucleus. Morph is shape or form, so morphology, study of shape or form. Myeloblast would be a bone marrow cell that develops into a myelocyte and then a leukocyte. Neutral, so neutropenia, deficiency in neutrophils. Nucleus, mononuclear, pertaining to a white blood cell with one large nucleus. Phage, eat or swallow. So phagocyte, cell that ingests other cells or microorganisms. Poikile, that means poikile, varied or irregular. So poikilocytosis, irregularity in the shape of red blood cells. Cider, not apple cider, but cider, iron. So sideropenia, deficiency in iron in the serum. Sphero is globe, like a sphere, but spherocytosis is condition abnormal in which erythrocytes assume a spheroid or a rounded shape. And thrombo is a clot, so thrombocytopenia, deficiency of clotting cells. So here's some suffixes that you might see. Remember, apheresis, blast, site, cytosis, anemia, globulin, lytic, oid, osis, penia, phage, philia, phoresis, poiesis, and stasis. We kind of discussed those in chapters 1 and 2, so you might want to go back and review some of those. So like plasmapheresis, removal of plasma from the rest of the body by mechanical means. Leukopheresis, removal of white blood cells from the rest of the body. So pheresis might be something as removal. Blast, monoblast, immature white blood cell. Erythroblast, immature red blood cell. So blast would be immature. Okay. Cytosis would be abnormal condition. Okay, so macrocytosis or microcytosis. Anemia, abnormal condition. Leukemia is an abnormal condition of white blood cells. Okay, globin or globulin, hemoglobin, blood protein in erythrocytes, enables the cell to carry oxygen. Okay, lytic, so thrombolytic, treatment that destroys blood cells. Oid, myeloid, derived from bone marrow. Osis, thrombosis, abnormal condition. So you have cytosis or osis, which would be abnormal condition. Penia, granulocytopenia, phencytopenia. Okay. Deficiency, penia would be deficiency. Eosinophilia, neutrophilia, which would be increase in cell numbers. Pheresis, electrophoresis, it would be separation of proteins in a solution. Hemoptysis is formation of red blood cells. Erythropoiesis, formation of erythrocytes. And stasis is stoppage of flow of blood. Now again, we talked about anemia. So anemia is a deficiency in erythrocytes or hemoglobin. So you have aplastic anemia, hemolytic anemia, pernicious anemia, which is a B12 deficiency, sickle cell anemia, thalassemia. Aplastic anemia would be failure of blood cell production due to aplasia or absence of cell formation of bone marrow. Hemolytic anemia is reduction in red cells due to excessive destruction. Pernicious anemia, lack of mature erythrocytes caused by inability to absorb vitamin B12. Sickle cell, hereditary disorder of abnormal hemoglobin producing sickle cell shape, common in African Americans. Thalassemia is an inherited defect in the ability to produce hemoglobin, leading to hypochromosia. So here are some: pernicious anemia, hereditary spherocytosis, thalassemia, and sickle cell anemia. Quick quiz, what's the most common type of anemia? That would be iron deficiency anemia. That's the one that you're going to see mostly in the clinic. Hemochromatosis is excess iron deposits throughout the body. Polycythemia vera, general increase in red blood cells. Hemophilia is excessive bleeding caused by hereditary lack of factors 8 and 9 necessary for blood clotting. Patients often bleed into weight-bearing joints, especially the ankles and knees. It can be life-threatening. Purpura is multiple pinpoint hemorrhages and accumulation of blood under the skin. So how do you treat hemophilia? You administer a deficiency factor. Leukemia, that's an increase in cancerous white blood cells. So you have acute myeloid leukemia, acute lymphoid leukemia, chronic myeloid leukemia and chronic lymphoid leukemia. So there's acute myeloid leukemia and acute lymphoid leukemia. Other diseases of white blood cells: granulocytosis, abnormal increase in granulocytes in the blood; mononucleosis, infectious disease marked by increased numbers of mononuclear leukocytes in large cervical lymph nodes; and multiple myeloma, malignant neoplasm of bone marrow, malignant cells, destroy bone tissue and cause overproduction of immunoglobulins. Some lab tests that you might see the antiglobulin test, CBC, which is complete blood count, ESR, erythrocyte sedimentation rate that you might do for RA factor, hematocrit, hemoglobin tests, and the partial thromboblastin time, which is the PTT time, your platelet count, prothrombin time, PT, red blood cell count, red blood cell morphology, white blood cell, white cell differentiation. Now, apheresis, separation of blood into component parts and removal of a select part of the blood. Blood transfusion, whole blood or cells taken from a donor and infused into a patient. Bone marrow biopsy is a microscopic examination of a core of bone marrow removed with a needle. Hematopoietic stem cell transplantation, peripheral stem cells from a compatible donor administered into a patient. So here's some easy abbreviations: AB antibody, ABMT, autologous bone marrow transplantation, ABO, 4 main blade types, ALL, acute lymphoid leukemia, AML, acute myeloid leukemia, ANC, absolute neutrophil count, ASCT, autologous stem cell separation, BANDA, immature white blood cells, BASO, meaning basal, BMT, bone marrow transplantation. You'll see these abbreviations in the medical chart, so you could always look these up, so you don't have to memorize all of them. I mean, I'm sure a lot of people, nurses, stuff still look these up, but there are some common ones that you should know. CBC is one, complete blood count; CLL, chronic lymphoid leukemia; CML, chronic myeloid leukemia; DIC, disseminated intravascular coagulation; DIF, differential count; EBV, Epstein-Barr virus, you should know that; eosinophils; EPO, erythropoietin, you should know that; ESR, you should know; erythrocyte sedimentation rate; FE, iron, you should know; GCFs, GM-CSF, GV, HD, HCl, I mean, some of these; HCT, you should know, hematocrit; HGB, hemoglobin; H&H, hemoglobin, hematocrit; HLA, human leukocyte antigen. Those are just the immunoglobulins, ITP, lymphs. MCH and MCHC you might see in the bloods, and MCV, mean corpuscle volume, mean corpuscular hemoglobin; MDS, myelodysplastic syndrome, monocyte polys. PT pro time, you should know that, prothrombin time; and PTT, partial prothromboblast time. Again, these are usually taken for patients that are on blood thinners, and a certain time is indicated in the chart. RBC, red blood cells, SED rate, erythrocyte sedimentation rate, and SAGS, SMAC, sequential multi white blood cell is WBC, and WNL is within normal limits. So you'll see WNL used a lot, so you should definitely know that. All right, a lot of stuff with the blood.